Good morning. Welcome to day 5 of MS Connect. My name is Gayleen Bonifant, and I'm a member of the National Board of Directors. I'm honored to be your host for today's session. As we move into presentations today, I would personally like to thank each one of you for investing your time into learning more about MS and MS research. Now, more than ever, it's vital that we build our momentum created through MS research and push forward to discover future breakthroughs that will positively impact the lives of Canadians affected by MS. We would like to say a special thank you to our sponsors for making this event possible. Thank you to our lead sponsor, Roche Canada, and contributing sponsors, Biogen Canada, Bristol Myers Squibb, EMD Serono Canada, Novartis Pharmaceuticals Canada, Pendopharm, Sanofi Genzyme, and for providing our financial support to make this virtual conference possible. Before I introduce our speaker today, please allow me to share a few housekeeping details. Questions can be typed into the question box at any time throughout the session. Join the online conversation and share your favorite moments from today's session by posting on Twitter using the hashtag MSConnect. Make your voice heard and respond to our daily poll on your Twitter page at MS Society Canada. And this session will be recorded and will be shared at msconnect.ca. Now to introduce our guest speaker for today. Dr. Finlayson started her career as an occupational therapist providing clinical services to people with a wide range of conditions and functional limitations. After several years of clinical practice, she returned to university to complete graduate work in community health, focusing on mobility-related factors that influence the ability of older adults to access health and social services in their communities. During this time, she also began volunteering for the MS Society and conducting research to support advocacy efforts. For the past 20 years, these links have enabled Dr. Finlayson to focus her research on understanding patterns and predictors of service use among people with MS, and then using this knowledge to develop and implement and evaluate self-management programs that enable people with MS to exert choice and control over their daily lives. Dr. Finlayson's research has been supported in part by the MS Society of Canada. Welcome, Dr. Finlayson.
Hi, everyone. My name is Marcia Finlayson, and I'm very pleased to be with you here today. And I'd like to thank the Multiple Sclerosis Society of Canada for inviting me to present at the MS Connect conference this year. So my topic is MS fatigue management, state of the science. And what I'm going to try to do over the next half hour or so is give you an overview of what we currently know about fatigue and how to manage it in the context of MS, what the current literature evidence is saying, what are some of the things that are currently in process, so new studies and upcoming studies, and the specific areas that we know that we need to investigate in future work. So with that, I will get started here. So what we currently know about MS fatigue is that it's very common. The literature would suggest that 70 to 90% of people with MS will report experiencing fatigue at some point during their disease process. And between 60 to 70% of people identify it as the worst symptom that they experience. It's the most disabling and affects all parts of their lives. The other thing we know about MS fatigue is that it's complicated. It's multidimensional, so it has physical and cognitive impacts, dimensions to it. There are specific disease factors that are thought to contribute to the experience of fatigue, and there's many non-disease factors, and I'm going to go through these different elements in the next couple of slides. The other thing that we know about MS fatigue, it has many consequences for the people who experience it. Fatigue is one of the things that most often leads people to stop working and complete their employment. It also is commonly known to have consequences for people's ability to maintain their households and do the everyday activities that we're all required to do. So whether that's paying bills or traveling to get to different places or keeping the house clean or keeping the family fed, these are all consequences of fatigue in terms of having difficulty carrying on these activities. Social and leisure activities are frequently affected by having fatigue. So often people are less willing to make plans, or if they make plans, they often need to cancel them. And overall, what you see is a decline in quality of life. So I don't think that any of the things on the slide are going to be a surprise to anyone who's listening in today, but I think it's really important that we start this presentation with just this overview. So we know that MS fatigue is common, we know it's complicated, and we know that it has many consequences. So for people with MS, fatigue is described in many different ways, and I just want to share with you a few quotes from some of the research that we've done. And these are specific things that people with MS have told us in our research. So first of all, we've been told that MS fatigue is like a constant tiredness. I wake up tired, I go to bed tired, I'm tired all of the time. We've also heard it's debilitating, frustrating, and scary. And it's like a constant heaviness, like walking in cement. We've also heard that MS fatigue has this impact. I feel like my world is shrinking. I have only so much energy during the day. The enjoyable things go to the bottom of the list. After the chores, I don't have any more energy. It's discouraging. I expect for many of you that are listening in today, one or more of these quotes may also reflect how you feel in your experience. So when you look at MS researchers, what we do when we're studying fatigue or fatigue management, we need to define what it is that we're trying to address. And so there's a number of different definitions that we use in the context of our research. And we define MS fatigue as an overwhelming sense of tiredness or a subjective lack of physical and or mental energy that interferes with usual or desired activity, or lack of energy or feelings of exhaustion. So these are some of the quite common definitions that you would see by MS researchers. Now, all of these definitions are what we would consider subjective because we have to ask people with MS whether or not they're experiencing these things. We can't necessarily see it or touch it or feel it, okay? So the other ways that we define fatigue in MS for MS research purposes is a difficulty initiating or sustaining voluntary effort. So the get up and go piece. The other thing, or the other way that we define it is a decreased capacity for physical or mental activity. So when we're looking at these things, we would consider these objective measures of fatigue. So we can actually test and see and score someone on these things. And we tend to call this fatigability, okay? So this is the objective part of fatigue. So it's commonly believed, or that we might assume when you think about these two different things, that when someone's self-reported fatigue goes up, so you have more reports of fatigue, or if I ask you, how are you feeling today? And you say, I'm very fatigued. So we might assume that when self-reported fatigue goes up, physical or cognitive performance, or those fatigability elements, would go down. But interestingly, there's no strong research evidence to support this. There's been repeated studies, many different countries, different methods, different kinds of testing. And most of these studies show no or very limited relationship between the experience that someone reports and what we can actually measure in terms of their actual ability to do things. So with this, I think it's really important that we put a disclaimer on what is going to follow for the rest of this presentation. So first of all, there's no consensus about how to define fatigue in the MS research world. Is it a subjective feeling, or is it actual performance decline? Or is there something else that maybe we haven't thought of? So we could go one way or the other, but my expertise is in the management of the subjective experience of fatigue and its impact on daily life. So I've spent the last 20 years of my research career examining what's it like for people with MS to experience fatigue, how does it make them feel, and how does it impact on their daily life. And what I've been trying to do in the work that I've done is find ways that we can reduce the impact on daily life. And sometimes this means altering the subjective experience, but a lot of times it's about managing it more effectively so people can do the things they want and need to do in everyday life. So with that disclaimer, we can carry on. And I do want to just acknowledge that because of this, I'm not going to be talking about, the biological aspects of fatigue, because that's not my area of expertise. So let's start with just taking a look at this idea that fatigue is complicated. I said that in the very early slide. And we really need to look at the dimensions of fatigue to understand possible ways that we could manage it. So first of all, I had said that fatigue is complicated because it's multidimensional. And there are several dimensions that have been identified. So first of all, the physical dimension. So that actual feeling of that, the quote that I had that was like walking through cement, that heaviness, that weakness, that just difficulty, like doing physical activities and just not having physical energy. The other way that fatigue has been described by people is the cognitive or the thinking aspect. So often what people will tell us is, I feel like I'm in a brain fog. I just can't get my thoughts organized. I can't pay attention. I can't stick with a task that requires thinking. There's also a psychosocial or emotional dimension to fatigue. So if there are things that you're unable to do that are really important to you, people tend to feel bad about themselves or that they're not meeting their obligations. And that has impact on mood and emotion and relationships. So the other aspect of the complication and the multidimensionality of fatigue is that it's both a trait as well as a state. And so what does this mean? A trait is something that we experience over time. So probably many of you who are listening in today have done some kind of questionnaire about fatigue, maybe when you go to your neurologist's office. And it'll start with something like, over the past month, have you had? And so you're thinking about average experience over time. What that's capturing is trait fatigue. There's also something called state fatigue, or things that are in the moment. So if I asked you right now on a scale of 0 to 10, how fatigued are you, where 0 is not at all fatigued and 10 is very fatigued, and let's say you gave a rating of 7, that's state fatigue, that's right now. If I asked you that very same question, maybe later on today, you might have a different answer. So state fatigue is in the moment. It's that variable, like over the course of the day, whereas trait is that more stable over time experience. The other complication, or what makes fatigue complicated, is that there's a range of possible disease factors, so the actual fact of having MS, that can contribute to fatigue. And what I'll just say, the caveat on this, is we're really not sure what it is about MS that contributes to fatigue. So there's a lot of really interesting work going on in this area around the world. And some of the three key areas that are being examined are the fact of the demyelination and the axonal damage of the disease process may be contributing to the fatigue. And the reason for that is when you have this damage, the body isn't working as efficiently. So it takes more energy to do things than it would if this damage hadn't been present. The other possible factor is the actual inflammation that is occurring because of MS, and the different cells that are involved in that may be, again, making things less efficient. And there's also the possibility that just the networks in the brain and the way that the parts of the brain talk to each other, or the chemicals in the brain, may be contributing. So it's really important to know that there's work going on in this area. And I will just say again, this is not my area of expertise, so I'm not going to be able to answer any questions later about it. But there is a lot of work going on in this area, and it's very exciting. So the other part about the complications of fatigue is that there's all sorts of what are called non-disease factors. Sometimes they're called secondary factors. And the really important thing about the secondary factors of fatigue is that anyone could experience these. You don't have to have MS to have these other things going on. So if you're sick, you have an infection, you're more likely to feel fatigued. If you have depression, you're more likely to feel fatigued. If you're deconditioned or you're not very fit, that can contribute to fatigue. If you have sleep problems, etc. So all of these things are outside of the disease process. They could be experienced by anyone, regardless if they have MS or not, but they contribute overall to the experience of fatigue among people with MS. So the other thing I want to also address here is that we have to remember that when we're thinking about the consequences of fatigue for people with MS, fatigue negatively influences the things that you want to do, you need to do, or are expected to do. And all of these activities also have complexities. So if you think about the overall activity of parenting, or being with family members, or being with friends, there's different people in different environments. Depending on what you're doing, you need different knowledge and skills. You may need different kinds of equipment, or it takes different amounts of time, or be done at different times of the day. And there's also expectations of performance, what you're going to do and what you're going to achieve. So the really important thing here is that you have a situation where you have this complex symptom, fatigue. So we said it's multidimensional, it has disease aspects, it has non-disease aspects. And then you have activities that you want to do, need to do, or expected to do that have all sorts of dimensions. And these things together is what results in the impact on your everyday life. So a very complex set of situations here that do make a big difference in the experience and how we need to think about managing fatigue. So we have a complicated symptom with complex impact. So we really need to have a stepwise and multi-pronged treatment approach. So what do we know so far in terms of the research? What are the approaches that have been studied? So there's basically three. There's the whole area of what we would call self-management or energy management. These are things like either a combination of patient education, counseling, skill development, okay? Many of you may have received some of this either through a group or one-to-one. There's also the exercise is something that has definitely increased in awareness in terms of the benefits for managing fatigue, and also medications. So these would be the three overarching approaches that have been examined. And what's important about all three of these things is they all have a behavioral element. In other words, they require people with MS to they need to do something to partake in these interventions. So even if you think about medications, you actually have to do something. You have to take the medication on time, on a particular schedule, and be consistent. If you're exercising, you have to exercise regularly. You need to build up your capacity over time, those kinds of things. And if you're doing patient education and skill development, you actually have to practice the things you learn and put them into effect in your everyday life. So we have to consider that when we're looking at all of these things, and if we're saying you actually have to do something to participate in these interventions, and that it's actually work, it's not a passive process, is that there's many things that contribute to your ability to partake, do something, and engage in the work of managing MS. So first of all, you actually have to have the capability of doing it. So this means you have the knowledge, the skills, and the capacity to be able to engage in whatever the behaviors are. You also have to have the motivation to do it. You need to want to make changes so that you can do the things that you want and need to do, okay? And you also have to have the opportunity. So this really means that your environment supports you to be able to engage in these key behaviors. So we have a complex symptom, complex impact. In order to deal with it, we have a number of different strategies that require some work. And this work has many, many different dimensions, okay? If you take away the opportunity but have capability and motivation, it's going to be hard to do the work. If you have the capability and opportunity but not the motivation, it's going to be hard to get the work done. So all of these things play into consideration when we're trying to develop interventions and test interventions through research to help people with MS manage their fatigue. So what do we know? What's the research evidence to date about these approaches? Well, there's a lot. So what's on the screen here are examples of articles, 6 articles, that are what we call review articles. So they're systematic reviews. So what the authors do is we go and we look at all the science that's being completed so far, and we compile it all together, and we draw conclusions based on the findings of many other studies. So across all of these different reviews, they would have looked at what's already out there and what the evidence says. And what we find, sort of the broad themes about the evidence to date, is that you really need to be ready to actively manage fatigue. So people who aren't motivated or don't feel it's the right time are going to have difficulty managing. In order for fatigue management to be effective, as the therapists or the clinicians engaged in this work, we need to help people reframe their thinking about the potential. So if you don't believe that you can manage your fatigue, it's going to be really hard to manage it. So we have to work with people to reframe their thinking. We also need to help people develop knowledge and skills. So there's no magic bullet here. We actually need to help people to develop the knowledge and skills so that they can take actions to manage their fatigue. And it's really important to build confidence. If people don't feel confident that they can do it, then they're going to have difficulty carrying through. So across all of these 3 approaches, particularly the educational, behavioral education, the exercise, if we don't have these things in place, it's going to be very hard to move forward. So what have we discovered when we've done some of the research, particularly in the patient education piece and the behavioral strategies to support fatigue management? What we found is that there are some things that are easier for people to put in place to manage fatigue, and there are things that are more difficult for them to put into place. So for example, setting priorities and spending energy based on priorities is easier to do. You know, actually putting regular rests in at the day is easier to do. moving things so you're not spending so much energy hunting down your house to be able to get a task done really helps. Delegating things to other people and communicating your needs, like actually asking people for help. All of these are strategies that the research has shown are easier for people with MS to do and help them manage their fatigue. The things that are more difficult to do, which would suggest that we need to find other ways of supporting people to do these things, is what's called ergonomic positioning of the body. So using your body to its best advantage when it works most efficiently. Changing work heights. So if you're constantly bending over to do something that uses more energy than standing up to do it, so you might have to change the height of a table or a counter. That's harder to do. And that's often because there's somebody else in your world or in your household that it's not convenient for. So there's some negotiation that has to happen. Using equipment is often more difficult because there's a learning curve, learning how to use a particular piece of equipment, maintaining it. So it might be helpful in the long time, but it actually is more difficult to put into people's everyday lives. Eliminating steps of an activity can help manage fatigue, but it's hard for people to change the way they do things. And also finding this balance between work and rest. And that's difficult because when you feel good, you just want to keep going. So what are some of the things that influence strategy use? What has the research said? So there's 3 things that have really come out in the work that's been done so far that shows us that there's many other complex factors that influence a person's ability to use strategies to manage fatigue. So first of all, is there just the experience with the disease. So if your MS is stable, okay, and you're not having a lot of difficulty, there's a lot less urgency to use fatigue management strategies, even if you're experiencing fatigue. So the motivation tends to be less. And it's also harder to use strategies when cognitive fatigue is the primary dimension that you're experiencing, because it's harder to work through and figure out how to apply strategies in everyday life. The other thing that we found in the research is that your sense of self and who you are as a person and what's important to you, that really makes a difference in ability to engage in fatigue management. And it's easier to use strategies when you're ready to make the change because you've said, my life priorities are being compromised and that's not okay. So I am going to make this change because I want to be able to do the things that are important to me. And the last thing is just environmental strategies. So it's much easier to engage in fatigue management and do that work of fatigue management when you have support at home and at work. So those aren't, big surprises, but I think it's really important to articulate these things because it does impact where we need to go in the future and the kinds of things we need to learn more about. So what are some of the early findings about the factors that influence people's success in terms of engaging in fatigue management strategies? So first of all, we have learned, or we're learning right now, is that the timing of when we provide people with interventions about fatigue management makes a difference. If you go into, your MS clinic and you say, I'm ready, I need to make a change, I want to engage in fatigue management. If you have to wait to get that intervention, waiting actually reduces the benefits. So we need to be able to provide it in a timely way to get maximal benefit. The other thing we've learned is that your age and your sex actually makes a difference in terms of success with these strategies. So people who are younger tend to have greater reductions in fatigue impact when they are engaging in fatigue. So in other words, they engage in these strategies and they actually have more results in terms of less impact on their everyday life. We've also found that even though fatigue management interventions are about managing fatigue, Men tend to have greater mental health benefits, so they have different kinds of ripple experiences. So it's not just about the fatigue, there's other things going on here. And also level of disability does make a difference in success. So people who experience less physical disability have tended to have greater mental health gains with fatigue management, and also tend to retain those gains for a longer period of time. We also know that people who have other comorbidities, so other health conditions, it actually changes the trajectory of their improvement. So if they have other complex chronic conditions, for example, like maybe diabetes, where there's a whole range of different routine activities that you need to do, it's harder to benefit from fatigue management, because now you have all of those other strategies, plus you're adding more, and getting all those self-management strategies together can be fairly complex. So what do we need to figure out next in this whole area of research? Well, I've sort of divided it into 4 categories. We need to know what to do in terms of the sequence. So I've said that there are educational interventions and behavioral interventions to teach people strategies they can do in their everyday life to manage fatigue. There's exercise interventions, and there's also medications. So what order do we give these in? And this is something that we really haven't figured out yet. So this is an important direction for future research. The other thing we really have to figure out is, when do we give this? Do we give it early in the disease process? Do we do it, is it like a course that you do once a week for 6 weeks and then you have some kind of booster session later? Do you know, all the things about the timing, like when, how often, how many times do you need a booster session? We need to figure those things out. We haven't done that yet. The other thing we have to figure out is, how do we deliver these interventions? Do we deliver them in person? Is it one-to-one? Is it a group? Do we do it by technology? So clearly these days, in a COVID world, we're doing a lot of stuff technologically supported that we never thought we would be able to do. But it's always a constant question, because not everybody has access or easy access to like an MS center or a rehab center close to their homes. So we've always been wondering about this, but now it's even more acute because of the issues around COVID. And the last thing that we need to really ask is who? Who are the people who benefit the most? And when is it in their disease course that people are most likely to benefit? We really need to figure these things out. So these are big questions for future research. So what's in progress right now? What's the research that's currently being done? And so what I did to answer this question is I took a look at what's called clinicaltrials.gov. And this is a US-based website under the National Institutes of Health that researchers who are engaged in clinical trials register their trials. So you can go on at any time and take a look at all the research that's going on to test interventions or treatments for people with MS or any other kind of condition. So I took a look at this website, and what we found is that there were 86 different trials that are happening right now that are currently recruiting that are addressing some aspect of fatigue, MS fatigue. And what was really interesting to me is that these studies are happening all the way around the world. And here's just a list of the countries where you're seeing studies. The other thing that's really exciting is just the wide range of interventions that are being examined. So we do have the exercise, which I said was a common, one of the common approaches, one of the 3 most common, and the whole self-management, that's the patient education piece and reframing. But look, and medications, that's the other thing. But look at the other things that are happening. We're starting to see studies of diet and the role of diet in fatigue. We're starting, you know, there was a really interesting study on hypnosis and whether hypnosis can manage fatigue. And also transcranial direct current stimulation. And this is when there's very light electrical currents that are put through the brain, and looking at whether or not that makes a difference in fatigue. So some really interesting things. So I picked out just a couple of ones that I think are interesting, or ones that I'm actually involved in. So one is called the Refresh Study. It's currently in progress. It's being funded by the Patient-Centered Outcomes Research Institute in the US, and it's being led by Dr. Matt Plow, who's based at Case Western University in Ohio. And there are two groups of Canadian collaborators, one at Dalhousie and one at Queen's. So I'm involved in this study as a collaborator. And what we're trying to do is recruit 600 people with MS, and we are randomly allocating them to one of three groups. They're either getting the intervention by one-to-one delivery, so in person with a therapist. Well, now we're going to have to do it by Zoom. We're doing it by teleconference, and we're also doing it web-based. And what our hypothesis is that if we have the same content in the same order, it doesn't matter which way it's delivered. So remember when I said that the next areas for future research is what and how and who benefits? This trial is really addressing how, like how do we deliver it and what difference does it make? Another example is this is a trial that's fully self-directed delivery, and this is one that I'm leading that's funded by the MS Society of Canada, and we're almost complete here. And we have collaborators from the University of Alberta, and we have, I'm not exactly sure, we just have about 150 people with, we focused on people that have mild to moderate fatigue, which is different than other studies, which tend to focus on people with severe fatigue. And what we've done is we have a website that's called MS Inform, and people are randomly allocated to have access to either MS Inform or what is a standard care set of information. And what we believe is that the MS Inform, which allows you to go through at your leisure and focus on the things that are most important to you, will actually be superior to usual care. The MS Inform has people go through goal setting and managing, identifying ranges of fatigue and looking at different strategies and choosing strategies that match with what they want to achieve. Another study that's going on right now is called the My MS Toolkit. It's a comprehensive toolkit. It's not specific to fatigue, has fatigue elements, and it's being tested along with coaching. And so it's a small pilot study that's being done at the University of Michigan. And what they hypothesize is that if you provide coaching to support people's use of this website, that it's feasible and acceptable and it can have benefits. And one of the outcomes they're looking at is fatigue. So what's next in the MS fatigue research world? So that what are the things we really need to try to resolve? First of all, there's a really interesting emerging discussion that is starting to happen in the literature. And remember, if you remember to the back of the beginning of the presentation, I said that we don't have a consensus definition. Everyone defines it a little bit different. There's this fatigue, subjective, fatigability, objective. And so the argument right now in the literature is if we can't define it, we can't measure it, and we can't figure out how to fix it. So the question now is, should we rename MS fatigue? There's some really common observations over 200 years of literature in MS, and can we use things to redefine and relabel what we have historically called MS fatigue? I think that's going to be a really interesting thing to follow. The other thing that we really need to try to do is really dissecting the work or the behaviors of MS fatigue. There was a recent review that looked at what's called the work of managing a chronic condition. And these authors found that people have the most difficulty managing a chronic condition when the strategies they are dealing with are cognitive or invisible to others versus others can see them. If they have to do them alone, okay, and if they consume resources like time, money, space, and travel. And so if you recall, I talked about the strategies that were easier or harder for people to do. And we really need to look at that in more depth and in the context of these different dimensions, because I think that would really help us choose things. We want people to have resource creating ones that that others can see so that they can get the support that they need. The other thing that we have to do in this area of research is we have to link subjective and objective. So, you have the experience of MS fatigue. So when you tell us, we can't measure it in an objective way. So there's a lot of efforts right now going on to identify what are called biological or biomarkers for MS fatigue. There's a lot of things happening in this area. So is it a particular MRI measure that'll say, oh, that person's going to have MS fatigue or their fatigue is getting better? Is it a blood marker, a blood test of some kind? Is it a performance test? Or is there something else we haven't thought of yet? We need this because we need to be able to determine whether there's particular types of changes in objective performance, so maybe speed or quality or accuracy, that account for your feelings of fatigue. Can we make that connection? We need these things so that we can get better measures of fatigue that capture the complexity and the impact that I've already discussed. And then the most important thing of all is that we have to figure out the best way to make the leap between what we know from research about fatigue and fatigue management to what we offer routinely during MS care. Because if we can't translate this into what happens in the MS clinic or the therapy room or the rehab hospital or whatever, wherever you're getting your care, if we can't make that leap, then all this work is really of much lesser value. We have to be able to figure out, once we know all this stuff, how do we train up neurologists and nurses and occupational therapists and physical therapists and psychologists to be able to use the very best evidence to help you manage your fatigue. And so that's a real key thing for the future. So I'd like to thank you all for your attention today. I want to acknowledge my multiple collaborators who I've worked with for some of them more than 20 years on this whole area of MS fatigue and fatigue management. And I'd also like to acknowledge that over the course of my career and my work, I've had research funding from many different groups. And without their support, none of this work would continue. So I'd like to thank you very much for your attention today. And I hope that there was a few things that spurred your interest. And I look forward to our discussion and questions. Thank you very much.
Thank you, Dr. Finlayson. We really appreciate that. We're now going to open this up for questions. So please feel free to type your questions in the question box, and we will moderate them and have Dr. Finlayson participate in answering some of your questions. We have a question here already, and coming from A. Russell. Are there differences between fatigue in PPMS and RRMS, primary progressive or relapsing remitting MS?
So based on the information I've provided in the presentation, you can see that there's two types of definitions of fatigue, subjective and objective. And to date, we found very few differences in how people describe fatigue or performance issues. So based on current evidence, the answer would be no at this current point.
That's interesting, actually. Don't be shy. Send us some more questions. We're happy to help you understand more from Dr. Finlayson's research. Thank you from Corinne Kagan. Since fatigue is so subjective, what are the best ways or tools to measure it?
So right now, there's several different tools that are available. Probably most of you have completed something called the Multiple Sclerosis Fatigue Impact Scale. So if you go into the clinic, it is a set of 21 questions that asks you about different aspects. So it would, over the last 4 weeks, have you experience, difficulty conducting activities or having more difficulty paying attention. So those tools are very broadly used internationally, often translated into multiple different languages, and we can track scores over time. And so for what we have right now, those are the most commonly used tools, and both clinicians and researchers are familiar with them and use them regularly to track fatigue.
Excellent. And a question from Bruna Kawaguchi in Toronto. When you mention medication, does that include medicinal marijuana?
So, I'll be honest and say I haven't seen the use of medicinal marijuana in literature on MS fatigue. But I also haven't specifically looked for that either. So it may exist out there, but I'm not familiar with it.
Okay. And from Dwayne Lotman and from the US, what might be done to boost motivation?
So that's always an interesting challenge, isn't it? So I think one of the things, so I'm an occupational therapist by profession. And so what we focus on is what's important and meaningful in your everyday life. So if I were to be talking to you about what motivates you, my question would be, is what do you really want to be able to do? Like, what is the meaningful, important activity that fatigue stops you from doing? And then look at why is that important to you, and use that as a tool to keep you going. Because if you have a specific goal, something you really want to be able to do, it's much easier as opposed to this general, I'm going to manage my fatigue because I don't like feeling fatigued. Saying, I want to manage my fatigue so I can spend some time with my family or play games with my children and those kinds of things. That's my experience is what motivates people the most, is doing meaningful, engaging activities. Oh, I've just lost my audio for you.
For Gayleen?
Oh, there we go. I hear you now.
Okay. For Lisa Murphy, thank you. Please explain the disclaimer made that fatigue has no effect on cognitive or performance decline.
So it's not, I wouldn't say it has none, okay? But the evidence is very, we automatically assume that if you feel more fatigued, your performance goes down. And research over and over has not supported that. So it is kind of a perplexing problem, and there's not good explanations for it, but it is a consistent finding, and it's both physical and cognitive. So you may say, I feel totally, completely physically exhausted, but when we test people on physical tests, it doesn't necessarily play out. So it goes against everything we might think, but it's a consistent finding in the literature. So I don't have a good explanation, but none of us do. So
more room for research.
More room for research.
Nicole Tiller asks, is there a good way to determine how much exercise will help fatigue versus make it worse?
Yes. Yeah. And, this is a really interesting problem because if your subjective experiences is, I feel really tired, it's hard to get motivated to get going. And I'll just say this is not a problem that's unique to people with MS. Any of us that know that exercise is good doesn't mean we necessarily feel like going and doing it when we're feeling tired. But I think the most important thing is to be working with someone who's familiar with MS and knows how to grade what we call grade exercise, because you can't sort of start and think that you're going to do a maximum amount. You have to build it up slowly, and there's certain kinds of things that you do in sequence. So I'm not an exercise physiologist or a physical therapist, so I'm not the best person to say what the order is, but you really need to be working with someone who knows exercise and knows MS, who can get you started on a program that can slowly grade you over time.
Okay. That's awesome. Andrea Shute from Ottawa, thank you so much for your question. Thank you for this informative presentation. Practically, what would you suggest as a few tips for fatigue management or resources to access?
Okay. Well, in terms of some resources to access, the MS Society has a really nice pamphlet, and I think it's even called MS Fatigue. It's like a booklet, and it has some really good overarching materials that I think is a good place to start. I think the other thing that I would really encourage people to do if you're just getting started and you're trying to understand your fatigue is get into the habit at a regular time every day of evaluating your state fatigue. So remember I said there's trait, which is sort of long term, and state, which is in the moment. So I usually recommend that people pick a consistent time of the day, so maybe just before dinner or just after lunch, and on a scale of 1 to 10, rate how fatigued you are. So 1 or 0 is you're not fatigued at all, and 10 is just you're extremely fatigued. And then take notes about what you've been doing just beforehand. One of the things I find in the work that we do is that we really need to think carefully about what's happening in your life and what things are going on. And if you can start keeping a diary of your fatigue experiences and where you are at particular times of the day and what you've been doing, then it actually gives the therapist that you're working with some direction in terms of where potential areas of modification might be. Other things in terms of just really, really practical things, all of those secondary factors that influence fatigue, like your medication side effects or poor sleep or infection. So it's important to take a look at those things and say, okay, so maybe you have a new medication. Do you really understand the side effects of the medication? If you have questions, talk to your pharmacist or doctor, because sometimes people, you can make modifications to when you take it. So if it has a fatigue side effect, it doesn't have as much impact on your everyday life. If you're looking at things like sleep and you're not sleeping very well, you're going to have a lot of fatigue during the day. So there's some really great resources on what's called sleep hygiene. So ways to improve the quality of your sleep. There's also great tools on cognitive behavioral therapy for sleep to help improve sleep. So it's sort of when you look at all those different components of fatigue, take care of the things that are other things that are experienced by all of us. Sleep, understanding medications, making sure you're getting outside, getting some fresh air and some exercise, whatever that might look like for you. And then some of the other strategies are just looking at how you're spending your time. Are you doing it on the things that are important and the most priority to yourself? Because sometimes it's a matter of adjusting how much you're doing on a particular day or breaking down activities so you do them over several days. So there's a lot of different things. I'd start with that notebook or that pamphlet from the MS Society is some general information, and start tracking your fatigue so you can understand what triggers it.
Mm-hmm. So quite personal, but also the context is everything.
Context is everything, absolutely.
Okay, our next question from Dava. What resources are available at the employment level to help us if fatigue becomes too overwhelming? It is such a subjective and individual problem, of course.
Mm-hmm. Well, and the answer to that question is very much going to depend on what kind of size of organization you work in. So, if you work in a big company, the likelihood is that you have an occupational health and safety department or a return to work department where you can actually go and they can help you work through some accommodations. Sometimes in those situations, they'll make a request for an assessment by an occupational therapist to make recommendations on modifications that can be made for you at work. And, that's a legitimate occupational adaptation or accommodation. So that would be one thing. If you work in a smaller company, it might be a little bit more difficult. You still have the right to make requests for those accommodations. And it just may be that you need to work with your physician to get a referral to an occupational therapist that can come and do an assessment at your workplace. So that's where I would start. But you can get accommodations to manage fatigue at work. There are systems in place for that.
Okay, that's excellent advice. Thank you very much for that one. Scott Dunham from Toronto asks, what's the role, positive or negative, of caffeine in the management of fatigue in those with MS?
So that's a really good question that I actually don't know the answer to. I think
Okay.
one of the things that has been discussed more recently is the role of diet. And it makes a lot of sense when you think about it is, what we put into our bodies makes a difference in terms of how we feel. So we've just started to see studies about diet and the impact of fatigue. And so it'll be interesting to follow that literature over time to see what kinds of recommendations come up. But in terms of caffeine specifically, I'm afraid I can't answer that question.
Okay. Well, at the end of our question series today, we leave lots of room for further discussion and further sessions of MS Connect. Thank you so much, Dr. Finlayson.
You're welcome.
That's all the time we have questions for today, but don't forget to visit msconnect.ca to learn more about the available products and services and to view the work of up-and-coming MS researchers. I'd like to take a moment to recognize one of our MS contributing sponsors, Sanofi Genzyme, whose MS one-to-one patient support program is available to help people on their MS treatment journey. Join us later today for the MS Young Adult panel session, What Works for Me? Turning Evidence into Practical Solutions for Everyday Life. Ending off today is a much anticipated Young Adult social engagement session. Don't miss out on the chance to connect with your MS community. And lastly, thank you again to Dr. Finlayson for being here today, and thank you all for joining us.